A recent study on the abortion drug, mifepristone, that was published late last week in Nature Medicine, a monthly peer-reviewed medical journal, is getting glowing reviews from the legacy media. The study makes the claim that overall, and I'm quoting from it, 99.8% of abortions were not followed by serious adverse events. Now, these are abortions performed by the abortion pill. It goes on to say, in total, 0.25% of the patients experienced a serious abortion-related adverse event. But are these claims truthful? Or are the researchers in this study blind to the very real dangers of the drug to the mothers? Obviously, it's dangerous to the babies, but what about the mothers as well? Now, it's significant. The reason I'm talking about this week, we've talked about it many times, but the appropriations bills in the House are moving forward, and this is one of the hang-ups. I actually had multiple conversations with Republican leaders about this, because there are those that are trying to take a policy rider that's currently in one of those, it's the Ag Appropriations Bill, that prohibits this from being sold through the mail. And the Biden administration is pushing this to try to circumvent state pro-life laws. All right, that's what this is all about. Well, here to set the record straight on whether mifepristone is everything Nature Medicine and other abortion apologists are making it out to be is Dr. Ingrid Skop. She is a vice president and director of medical affairs at the Charlotte Lozier Institute. She is also a fellow of the American College of Obstetricians and Gynecologists. Dr. Skop, welcome back to Washington Watch. Great to see you again.
Thank you, Tony. I'm so glad to be back with you.
So first off, correct the record for us. This study claiming that mifepristone was not followed by serious adverse events in 99.8% of the cases. Is that true from your more than 30 years of experience as an OBGYN?
I have seen so many women harmed by abortion drugs, and I continue to see it in Texas. So on the ground, we recognize it is not safe. This study, of course, is the latest in a long series of demonstrations that the pro-abortion medical organizations and the pro-abortion scientific journals are now publishing what they know is poor quality research in order to promote abortion ideology.
Now, at the same time, are we not finding that there's an effort to try to stifle any scientific reviews that run counter to this narrative?
We are certainly seeing that. It's very sad what has happened to the peer-reviewed literature. In this case, this Nature Medicine article, a quarter of the women that they gave abortion drugs to, they did not know the outcome. So that in itself should disqualify the study. If you don't know what happened to 1 out of 4 women, you cannot assume that those were uncomplicated. The women that I've cared for often tell me they did not go back to the abortion provider because they realized they'd been lied to. And so I think it's very likely that these were complicated. In the United States, our data is very poor. We just don't have any mandatory data collection at a federal level. At Charlotte Lozier, we published a very high quality study where we did not lose any women to follow up because we looked at the data in the 17 states that that allow their Medicaid dollars to pay for abortion, and we were able to determine all of the events that occurred afterwards. What we found is that 1 out of 20 women after abortion drugs presented to an emergency room with a complication related to those drugs within a month. That's very high quality data. We didn't lose patients to follow up, and yet our studies have been targeted, and these other studies that are obviously just ideologically driven have been allowed to pass without any scrutiny from the pro-abortion media.
So, Dr. Skop, that brings up a really good point. If you're looking at a study and 1/4 of the individuals that you're studying just kind of drop off, how can you make these claims that it's 99.8% safe? I mean, how can you do that?
Well, You cannot, and that's not, anybody who knows anything about scientific research recognizes that is a problem. I would also say they were only looking at what they called significant adverse events, which they defined as a woman requiring a blood transfusion, admission to the hospital, a intra-abdominal surgery for a ruptured ectopic pregnancy, or death. I mean, of course, those are horrible events, but there are so many common complications that they ignored completely. Most commonly, approximately 6% of women require surgery because their body cannot expel all of the pregnancy tissue. That's very traumatic to women. Women who hemorrhage but don't lose half of their blood volume so that they require a transfusion are completely ignored. Women who have an infection requiring antibiotics, as long as it doesn't cause them to end up in an ICU, are ignored by this study. And of course, no one is looking at the mental health complications that follow abortion. And yet we know very, very common for women have anxiety, depression, substance and alcohol abuse, self-harm. High quality studies have demonstrated a woman is 6 times as likely to commit suicide in the year following an abortion than if she'd given birth to her child. But these studies, of course, ignore all of those complications.
Because it doesn't fit the narrative, and it doesn't fit the push that this administration is involved in trying to make these abortion pills available through the mail, like anything else you could get on Amazon. Dr. Skop, thanks so much for joining us. I'm sure we're going to be following up on this as Congress, I believe in the days ahead, is going to be debating this and trying to take it out as one of the policy writers. Appreciate the great work you do at Charlotte Lozier.
Thank you, Tony, for having me on. And we just need to keep fighting for women and their unborn children.
Absolutely, and we will.